Hello, everyone. I'm Steve,
And I'm Scott.
and together we are Backyard Musings. I'm broadcasting from Apple Valley, California.
And I'm in Utah.
Thank you for joining us today. Just want to reiterate we are not subject matter experts. We report articles that have been published by subject matter experts. Okay? So don't shoot the
Especially our
messenger.
last segment.
Except Scott happens to be an expert in marijuanaology. So,
Yeah. Thanks. Not
okay.
hardly.
COVID-19 isn't just a respiratory illness, it can silently attack the heart. New research reveals that the virus accelerates plaque buildup in arteries, increasing the risk of heart attacks and strokes long after recovery. The findings were published February 4th, 2025 in Radiology, the Journal of Radiological Society of North America, RSNA. Would you like to know more?
Okay, so we're all familiar with COVID. Hopefully you are, because it was a bad thing for about what, 3 years, 3.5 years or so.
Yeah.
COVID-19, caused by SARS-CoV-2, is initially characterized by acute lung injury and respiratory failure. And that's a quote by Jun Bo Ji, who is an MD, professor, and director of the cardiology department at Zhongshan Hospital, Fudan University in Shanghai, China. Did I say he was a senior author? Study senior author that we're talking here. So, okay. However, again, continuing to quote, however, emerging evidence indicates COVID-19 also involves an extreme inflammatory response that can affect the cardiovascular system. Didn't know that. Dr. G noted that this inflammation continues beyond the first month of infection, raising the risk of severe cardiovascular issues and even death. So,
yeah, didn't know that.
I wonder if a lot of those deaths maybe were of that, and all the, again, like we talked about on the segment here just the other day. Everybody that died during that period, it was COVID related because it had a dollar sign attached to it. You know, you got extra funding for that. So I don't know. We'll see.
Yeah, to understand this impact, researchers use coronary CT angiography, CCTA, to examine changes in the tissue surrounding the coronary arteries. They analyze signs of inflammation, plaque buildup, and the presence of high-risk arterial blockages. The retrospective study included patients who underwent CCTA between September 2018 and October 2023. The final study group of 803 patients, mean age was 63.9 years, 543 men, included 329 patients, 41% imaged before the COVID-19 pandemic, and 474 patients imaged during the pandemic. Of those, 25 patients were infected with SARS-CoV-2 before imaging.
All right. In my simple mind and my simple way of thinking things, COVID in our neck of the woods didn't really raise its ugly head until what? March, the end of the first quarter of 2019. So these guys were already doing studies on patients that supposedly had COVID in like 5 to 6 months earlier.
Yeah, SARS-CoV-2.
So how interesting that it started in China, but yet it's not Chinese related.
Yeah, I didn't even make that connection that you just said. That's an interesting connection.
Yeah. So anyway, okay. So the research team analyzed a total of 2,588 coronary artery lesions, including 2,108 lesions among the SARS-CoV-2 patients and 480 lesions among unaffected patients. I'm pronouncing that right? Correct? Lesions?
Lesions, yeah.
Yeah. For all patients, researchers compared baseline and follow-up measurements of the plaque volume changes, the presence of high-risk plaque, and inflammation. They also analyzed the relationship between SARS-CoV-2 and cardiovascular events, such as heart attack or revascularization procedure.
Okay, continuing this analysis, at baseline, the mean stenosis or narrowing of the artery per lesion was 31.3%. Only 8.1% of lesions had diameter stenosis of 50% or more. Compared to the uninfected patients, the plaque volumes grew faster in SARS-CoV-2 patients. Lesions in patients with SARS-CoV-2 infection had a higher incidence of developing into high-risk plaques, 20.1% versus 15.8%, and coronary inflammation, 27% versus 19.9%. Patients with COVID-19 also had a higher risk of target lesion failure, 10.4% versus 3.1%, an indicator of increased heart attack or stroke risk.
Wow. So do you know anybody that had COVID that has suffered from a heart attack or a stroke since then?
I don't know. Let us know if you know of anybody. I don't know.
Yeah. Again, a quote, inflammation following COVID-19 can lead to ongoing plaque growth, particularly in high risk non-calcified plaques. That was from Dr. G. Going on with a quote, patients with SARS-CoV-2 infection are at increased risk for myocardial infarction, acute coronary syndrome, and stroke for up to 1 year. He added that these effects persist during the aftermath of COVID-19, regardless of
comorbidities.
Oh, that's where you had already had issues before you got COVID, right?
Yeah.
Such as age, hypertension, and diabetes. Yeah, so it affected people with these issues more, and then of course with age, we saw that in that debacle in New York, right, where Governor Cuomo shut down all the nursing homes, wouldn't let anybody out. Yeah, effective management strategies for these patients are imperative, Dr. G said.
The findings suggest that SARS-CoV-2 infection may exacerbate cardiovascular risk by accelerating the progression of susceptible plaques and coronary inflammation. However, a more comprehensive understanding of the biological mechanisms is required to formulate preventative and therapeutic approaches. Quote, it's crucial to anticipate a heavier cardiovascular patient burden in the future as most infected individuals recover from acute SARS-CoV-2 infection, Dr. G said. Yeah, this is mind-blowing. I never knew this. I guess researchers are finding this out.
Yeah, so I'm not sure if I ever had COVID. I never tested positive for it. I think I may have had a small little bout with it, but I've known some people that were affected long-term. In fact, I know some people, family, that are still claiming to be affected by it, like what they call that long COVID.
Long COVID, yeah.
And that's been, a couple of years now. So I don't know. Interesting stuff. Hopefully this kind of information is shared with and study groups in the States.
Well, and it's not to cause panic to anyone, but perhaps you can, if you've had COVID, you can take a look and say, okay, I need to do something about my heart to get the plaque, get rid of the plaque, do something. Talk to your doctor about how do I get rid of plaque in the arteries.
Yeah. So,
all right, folks.
All right.
Thanks for joining us. We appreciate it.
Yep. Another good one. Thank you. Take care, everyone.